Abortion is an ethical dilemma that does not have one solution that's better than another. People's different opinions get in the way, whether it's their political, religious, or personal beliefs. And some believe that the second and third trimester of a fetus, they are considered developed enough to have their own opinion and beliefs and should have their own rights. But others believe that it is still under the mother's control and she should do what's best for her and her body and her fetus. With the new Roe v. Wade overturning, many women are left helpless in their state trying to find health and safety. To settle this, the government should guarantee at least one clinic available for them in every state, especially if the mother's life or baby's life is at serious risk. Furthermore, granting late-term abortion access for women helps promote fairness among the justice system and ideally eliminating the amount of violence and issues that follow this topic. Women in all states need to have access to late-term abortion clinics for situations that are beyond their control, such as their health or life. There are several different events that could happen during pregnancy, some in their control and most are not. Help becomes more difficult to access as women advance during their pregnancy, and doctors become less likely to help them due to controversial issues. The journal Late Abortions, Clinical and Ethical Issues by Warren M. Hearn discuss several different factors that go into the abortion decision. He states, women seeking late abortion at an advanced stage of pregnancy are frequently among the most desperate because of severe medical complications of the pregnancy, medical conditions that threaten the patient's life immediately, and severe social and mental health problems and complex combinations of these variation problems. Many doctors don't feel comfortable doing late-term abortions, whether it be for their own personal or political reasons or under the care facility that they work for. But either way, women are still left helpless in their pregnancy and are looking for help. Throughout my paper, I discussed the different circumstances women are in that cause them to need a late-term pregnancy. This could include misdiagnosis of the fetus, lack of money or resources for the baby, or the fear of family and relationship threats. Most women who are requesting for a late-term abortion are not doing so for no reason. There is something out of their control that forces them to make this decision. But taking away the opportunity for them to have this choice limits the amount of control that they have over their body and takes away some of their freedom and rights. Hearn touches more on the restrictive access women have to medical clinics for abortions, stating there, women, choices and chances for medical treatment that could save their lives is increasingly limited by widespread hospital prohibition of abortion, repressive anti-abortion legislation throughout the United States and in many other countries, especially limiting abortion after 20 weeks of pregnancy, the lack of interest among physicians and other healthcare practitioners in performing late abortions. This means that hospitals and doctors are limiting the amount of abortions and requests that they accept due to political reasons and to avoid any complications that the hospitals could face. And by not providing women with access to help with their pregnancy is unjust and cruel, forcing their bodies to go through something that is out of their control that they might not want to do. With these new laws passing, each state is setting limits for themselves and what they are not allowing in the abortion scheme, and it's inconsiderate and discriminatory towards women and their own personal lives. The best way to fix this is to provide at least one facility in every state for women to have access to. Women should be able to make the best decision for themselves whether to have an abortion or not without being influenced by the opinions of others. Abortions are discussed in both the Democratic and Republican Party, meaning that everybody has an opinion on them, whether it be pro or against. However, When a woman has to make this decision for herself, she should not have to deal with the opinions and responses from others and how they will react to her own choices. Women need the freedom and support to choose what is best for them and their bodies, and no one should take that right away from them, other people or a doctor or the government. Marge Berer, author of Abortion Law and Policy Around the World in Search of Decriminalization, includes an experiment in her study that analyzes women after they've completed a legal abortion service, and the study assessed their knowledge and opinions on the law. The results showed that 94% agreed with the current abortion laws, that abortions are allowed upon request at 12 weeks and 14 weeks if the woman was raped. Anytime beyond that, if the woman's health or fetal abnormality was at risk, anomaly was at risk, the abortions continued to be legal. 57% of people thought that the gestational limits of 12 weeks or more were acceptable. However, 40% favored a stricter limit at 8 weeks. 69% of people supported physicians' right to rejecting an abortion. And then in the data, you can see how close the difference is between the two opinions, whether to keep the abortion at 12 weeks or change it to 8 weeks. Though these opinions aren't as strong as the abortion versus no abortion laws, the percentages are still close together. 57% felt that keeping them at 12 weeks was best, and 40% saying that 8 weeks is what it should change to. So there's the 17% difference between the two sides, meaning that it's a close split and there are a lot of people for each side. Now, as these differentials in percentage get closer as the topic becomes, when talking about abortions and the topic is broader, like abortions versus no abortions rather than 8 weeks versus 12 weeks, the percentages get slimmer as people choose one side or the other, meaning there's more controversy to arise on either side. And everyone has an opinion, and some opinions are stronger than others, but they are all taken into consideration when it comes to a non-measurable topic such as abortions. Berer's study shows that 91% of participants believed abortion is the right of every woman, and 78% felt that most women seeking abortions have justifiable reasons. However, 60% also agreed with the statement that women often seek abortions due to lack of responsibility. And as mentioned before, there are countless reasons as to why women ask for abortions. It is not just because they made a mistake or forgot to use protection, or it could be they aren't ready, they're young, their body is young, they went through a situation that caused them to get pregnant. There are hundreds of reasons why women seek abortions, and some of them don't have access to the care that they need based on these new laws about that each state can decide how much they restrict abortions, whether they allow it or don't. And then in conclusion, there's no one answer that's better than the other, especially when it comes to an ethical dilemma. However, giving women access to a facility in every state is the best solution. And opinions are persuasive and can be controlling, but they should not be forced to share or forced to change someone else's. Giving women at least one facility in every state validates their right to care and protection and gives them an option in order to make the best decision for themselves as an individual and control over their bodies.